All right, let's dive into a company that's tackling one of the biggest threats in modern medicine, the rise of the superbug. We're going to be looking at Ondine Biomedical, a company that thinks the answer isn't a stronger drug, but something, well, something much more brilliant.
Let's start with this number, 1 in 11. Now, what's that? Well, that's the high-end risk that a patient anywhere in the world could get a new infection while they're in the hospital. Think about that. This isn't some rare freak occurrence. It's a massive, hidden crisis playing out in our healthcare systems every single day.
And at the heart of that crisis is this term, antimicrobial resistance, or AMR. You've probably heard of it as superbugs. These are germs, bacteria, fungi that have literally learned how to beat the very drugs we designed to kill them. Our best antibiotics are failing. And that means routine surgeries, things we take for granted, can suddenly become life-threatening. This isn't some sci-fi problem for the future. It's happening right now. So what do? How do you fight a bug that's immune to your best drugs? Well, Ondine's answer is kind of surprising, but also incredibly elegant. You fight it with light. The science behind it is called photodisinfection. Here's the simple version. You apply a special solution that's sensitive to light, and then you shine a very specific color of light on it. That light flips a switch, creating a reaction that physically rips apart the cell walls of any pathogen nearby. Bacteria, viruses, you name it. And here is the absolute key. Because it's a physical kill, not a chemical one, the germs have no way to evolve and build up resistance. It's like trying to evolve a resistance to being torn apart. You just can't. So how does this look in the real world? Well, they have a product called SteriWave, and it targets the nasal passages, which, it turns out, is a major hiding spot for these dangerous germs. And the process is so simple. A little bit of the photosensitizer is applied, a tiny light device is inserted, and then you just turn it on for 60 seconds in each nostril. That's it. The whole thing is done in under 5 minutes. And that's why this is such a potential game changer. It's painless, it's fast, it kills a super broad range of germs, but the most important thing, the absolute headline, is that it completely sidesteps the problem of drug resistance. It's a whole new way of thinking about infection control. And hey, don't just take my word for it. This quote is from Monleeki Healthcare. They're a global giant in medical tech and a huge strategic partner for Ondine. When a player like that gets on board, it tells you that the potential here is absolutely massive.
Okay, a cool idea is one thing. But what really matters is whether it's actually being used, right? So let's look at how this is moving from the lab into actual hospitals, because this is already happening. You can see the story of adoption right here in these bars. It's all about accelerating trust. We go from 16 hospitals in 2022 to a forecast of 41 in just a few years. That's more than doubling. This kind of curve shows you that as more hospitals see the real-world results, they're jumping on board. So why are they adopting it? What's driving this? Well, it's because the benefits are crystal clear. For you, the patient, it means a lower risk of a dangerous infection and getting home sooner. For the hospital, it means fewer people coming back with complications, more beds available for others, and, massive cost savings. It's a win for everybody. And to put a number on that real-world experience, check this out. More than 200,000 patients have already been treated with SteriWave. Every single one of those treatments is a potential infection that never happened, maybe even a life saved. Okay, so we've established the tech works and hospitals are buying in. But what's the long-term plan? What's the business strategy here? Let's take a look at Ondine's blueprint for growth. First off, the market opportunity is just huge. If you just look at using this before surgery in North America and Europe, that alone is a $6 billion market. Add in the ICU, and that's another $4 billion. And we're not even talking about other super high-risk patients, like people getting cancer treatments or dialysis. All in, you're looking at a potential market of over $10 billion a year. So how do they capture that market? They're using a really smart land and expand strategy. Basically, they get their foot in the door with one surgical team in a hospital. That team starts using it, they see amazing results, fewer infections, happier patients, and pretty soon, other doctors in other departments start asking, hey, what's that thing you're using? From there, it spreads through the whole hospital system. Now, the revenue model is the real key here. The light device itself, the hardware, a hospital can buy it or rent it. But the real engine for the business is the consumables. It's kind of like the razor and blades model. For every single patient treatment, the hospital needs to buy a new single-use illuminator and applicator. That creates this fantastic recurring stream of revenue that just grows and grows with every patient they treat. All this progress in places like Canada and Europe is fantastic, but it's all building momentum towards the ultimate prize, getting into the biggest healthcare market on the planet.
And the scale of the U.S. opportunity is just staggering. You're talking about more than 6,000 hospitals, over 35 million major surgeries every single year. If Ondine can capture even a tiny sliver of that market, it would be absolutely transformative for the company.
So how are they going to do it? Well, there's a very clear step-by-step plan. They're already deep into a crucial phase 3 clinical trial. Once all the patients are enrolled, they'll analyze the data, package it all up for the FDA, and then navigate that whole review process. And all the while, they're getting their launch strategy ready to go. It is a well-oiled machine. Of course, running a big US trial and getting ready for a launch takes money. That's what this number is all about. They recently raised about £11 million, and that cash is the fuel they need to get across the finish line and get that US approval.
And they're being incredibly focused with that money. Look at this. The huge majority, 57%, is going directly into that all-important US Phase 3 trial. The rest is for supporting the growth they already have. This shows you their number one priority. They are laser-focused on cracking America.
You know, as our old trusty antibiotics start to fail us, the whole world is scrambling for a new solution. Ondine is making a bold bet that the answer isn't just a different pill, but a completely different approach. And that really leaves us with a fascinating question to think about. Could something as simple and fundamental as light really be the future of how we control infections?